If you're a C-section mom wondering, what do I do after 6 weeks? Or even during the first 6 weeks, I have no clue on what I can do and I cannot do. This video is for you. In today's video, I am breaking down what happens to your body after the C-section surgery and helping you understand the healing timeline week by week so you know what to exactly expect every week after your C-section surgery. And if you want to know more about lesson 3s and beyond to understand what are abnormal things, what you can do to address that, and just beyond understanding the 5 steps in C-section recovery, diving deep into each of the individual steps, I highly encourage you to check out the C-section recovery program in the description below. Hi mamas, and welcome back to my channel. If you're new here, hi, my name is Shridi. I'm a board certified physical therapist helping postpartum moms just like you regain their core strength, heal their pelvic floor, and feel energized in 15 minutes a day. So let's get started with today's video. Whether your C-section was planned or unexpected, I want you to know this. Your body did something incredible, and it now deserves gentle, intentional care as it heals. In this video, I am talking about what happens to your body after a C-section surgery so you can better understand how the healing works and to give your body the time it needs without putting too much pressure on yourself, mama. This isn't just a normal abdominal surgery. C-section surgery means that your doctor cuts open through your skin, fat, connective tissue, the fascia, and ultimately reaching the uterus from where the baby is delivered. After delivering the baby, the doctor would close up with the stitches, but that's not it. Usually with any major surgery, all you have to do is take bed rest. But over here, you're also taking care of a newborn. You're feeding, you're managing their sleep schedules, diaper changes, while you are giving yourself and your body enough time to heal and recover. That is a lot of pressure on your body. So I want you to know that this process takes time and it will happen, but you have to give yourself grace. Don't push yourself too hard to make things happen, to try and do things you used to be able to do pre-pregnancy. Your body has been through a lot and it needs time to heal and repair and recover. Now let's understand what exactly your body is going through after this surgery. The first and foremost is your core muscles. Of course, during the 9 months of pregnancy, they get stretched and weakened. But during C-section, because those muscles are cut through to reach your baby, those muscles are super weak. Even after stitching them up, the strength does not come back. It takes a while and intentional efforts to regain that strength. So your core muscles are super weak and are not able to support you right after the surgery. Next, moving on to your nervous system, especially around the scar. Your nerve endings get affected. The nerve endings that pierce the muscles, because of cutting through those muscles, it gets affected. So even after stitching up, you will have hypersensitivity around that. You can feel numbness, you can feel tingling, and that is normal because your nerve endings are regenerating and regrowing to know what is normal. Your hormones are off, so your nervous system might feel off. You might feel excessive sweating, you might feel anxiety, you might feel overwhelmed. Those are all completely normal things to feel. I do not want you to feel worried if your scar feels off, you feel super sensitive, itchy, or just you have a lot of mood disturbances. That is totally normal. Then last is your pelvic floor muscles. Even though you did not push, during the 9 months of pregnancy, carrying that little one puts a lot of pressure on those pelvic floor muscles. So they again are stretched and weakened. So after the C-section surgery, though your main focus is the abdominal area, pelvic floor also needs equal attention and care. Those muscles are not functioning at their best right now. So we have to be more mindful on what things we can do and we cannot do so we do not make things worse on your pelvic floor. Now moving on to next is understanding the timeline of C-section recovery. Because I know a lot of times the doctor would be saying, oh, you're cleared at 6 weeks, but then what? What do you do next? And what do you actually do for the 6 weeks until you're not cleared to do anything? So let's understand the healing timeline and know what you can do every single week after your surgery. Now that you know what happens to your body after a C-section surgery, let's understand the healing timeline so you know what to expect during the first 6 weeks, but also beyond those first 6 weeks. Because let's be honest, your OB would just say, oh, you're cleared at 6 weeks, but then what? You have no idea what to do after the 6 weeks, or even during the 6 weeks. A lot of moms don't even know what to expect, what is normal. So now we're going to move on to the healing timeline so you have better understanding of what to expect during the first 6 weeks and then each week after that. So let's get started with first week 1 and 2. So these are your resting periods. So for most part, your doctor wants you to be in complete bed rest except for the times when you have to feed or take care of your newborn. This means that you do not want to be bending, twisting, or lifting at any cost. Those 3 movements are a big no. Bending, lifting, twisting. I repeat again. Those are the 3 movements that are big no during this period. And that is because you have a fresh incision. It is a huge abdominal surgery. So anytime you do those 3 movements, you are putting a lot of stress on those stitches and your core muscles. They're still trying to heal. Your stitches are fresh. So doing bending, lifting, and twisting is putting unnecessary stress and tension, and it can make things worse. And you can also start having bleeding over those incisions. So we really want to avoid any of those 3 movements. Now let's understand what is normal and expected during the first 2 weeks. So it is normal to feel pain, tingling, numbness around your incision. It is okay if you feel confused or not feeling attentive or oriented to your surroundings. It is okay if you need help getting out of bed or walking to the bathroom. Those are not things that you should be worried about, or it means that something is wrong with you. Those are very normal things and expected. So it is okay to ask for help. It is okay if you don't feel your best, you feel you're constantly confused. That is totally fine during the first 2 weeks. Or if your incision is feeling very tingly, numbness, soreness, and pain, that is totally fine. But now what you can do to manage the pain is use cold compresses, a cold pack wrapped in a towel, put it around those incisions and hold it for about 10 minutes, 7 to 10 minutes, depending on how much you can tolerate. And then try to do that about 3 to 4 times a day. So the ice or the cold is going to help calm down the inflammation around that incision, and that will really help you manage the pain. But what you can also do is try to wear loose clothing and something that is high waist. That way you are not rubbing against the incision. Or if it's easier, just wear a gown or a dress. That way you don't have anything going against that incision line. Try to wear things that are looser. We don't want any pressure in that area at this point. So next, moving on to weeks 3 and 4. During this time, you will notice that your incision has started healing from outside. It would look a lot more smoother than it did in the first week, but there is a lot more work that needs to be done with the deeper tissues inside. So even though apparently from outside your incision is looking better, that does not let you start bending, twisting, and lifting yet. Your deeper tissues are still healing and are still very weak, so we do not want to put any extra stress than needed. But now, if you still have pain around the incision, you will move from using the cold compresses to warm compresses or the hot packs. But keep in mind, we don't want it to be super hot. You want it to be warm where it is warm enough that is tolerable, but it should not be emitting heat so very strongly. And it's the same thing. Use it for about 7 to 10 minutes, 3 times a day, depending on how your pain is doing. Now, what is normal during this time is as your incision starts healing, you will notice a pulling sensation, tightness around the incision. You will notice difficulty moving around. Just even getting out of bed might feel harder because everything is tightening up over here. I don't want you to worry about it because we will work on scar mobilization after 6-week time. or in the next module, we will go deeper into that. But for now, I just want you to know those sensations around your scar or incision is totally normal. Pulling, stretching, feeling tightness, that is completely normal during this period. And the good part is you might start feeling your energy coming back by now. By week 4, you might start noticing your hormones start stabilizing a little bit, and you will feel more oriented, less confused, less overwhelmed, and you might feel a little more energized than you did in week 1. Again, your sleep schedule will be all over the place with the newborn, so we're not expecting you to feel exactly what you did before delivering the baby. But this is more compared to week 1 after the surgery. You will start noticing a difference and feel a little better by week 4. Again, it's all about small steps, noticing those small changes and consistency over time. Don't give up thinking, oh, this is not working fast enough. This is not a sprint, it's a marathon. It's a long game. So be patient and give yourself grace as you navigate each week, 1 week at a time. Next, moving on to weeks 5 and 6. This is the time when you'll go see your doctor at the 6-week mark, and you might be cleared to do anything you like depending on how your OB feels about your recovery. But also during this time, you will be moving around a little more. You will feel comfortable getting out of the bed, walking to the bathroom. And what this means is the more you move around now, the more you will notice how stiff your body is. You'll notice the tightness around that incision. You might notice if you have to bend over, it might feel pain in the incision area, but it might also cause low back pain. If you have to reach forward to grab something, or you have to reach sideways, you will notice the stiffness and pain. So during this period, because you will start moving a little more than you did previous weeks, you will start noticing more pain, more tightness, and more discomfort. Again, this is normal. It does not mean that you have anything wrong or you're broken. It's just because now you're moving more, so you're noticing the discomfort more. In the initial phases, because you were resting more and you were trying to stay in bed for longer, or just minimizing your movements to going to the bathroom, your body was not used to so much activity. But now by week 5 and 6, you're getting around the home more. You're going to the bathrooms by yourself without help. You're doing feedings, diaper changes, lifting your baby maybe now. So you will notice, because you're using your muscles more, that you feel more weaker, tighter, discomfort, heaviness. All those feelings are very normal during this period, and we will work through in the next modules on what you can do to start minimizing those things. That way you can feel better and feel more confident. But this was just to give you an idea of what the first 6 weeks would look like every week and what you can expect to be normal. So now in the next lesson, we will be talking about some of the things that are concerning, or some of the things if you notice happening, it means you need to seek out for help. So far we talked about all the things that are normal and what you can expect. But now next lesson is focused more on the things that are not normal and what you can do to address those things. So I really hope you found this video helpful. If you did, make sure to hit that like button below and hit that subscribe channel if you're new, so you do not miss a postpartum tip from me. And if you want to know more about lesson 3s and beyond, to understand what are abnormal things, what you can do to address that, and just beyond understanding the 5 steps in C-section recovery, diving deep into each of the individual steps, I highly encourage you to check out the C-section recovery program in the description below. But I'll see you next week. Bye.